So welcome to our reflection after module 6. In this module, we have a case study with Marcus as the social worker. Marcus has been in a situation with a client who is experiencing homelessness. The program is uh, homelessness, housing, and medical program. He overhears his colleagues talking about the client and describing the client as not healthy enough to benefit from the services. Why would we give this opportunity to someone who is in poor health and maybe will not persist through our program? I think there are so many different areas, of course, in this. The lesson uses this case study as a way to explore social Darwinism and the origins of that. This phrase that we've come to understand, survival of the fittest. I invite you to look at the full history of this discussion and enjoy how these sentiments have filtered through not only our American experience, but also our international, primarily British origined kinds of discussions. And then the comparison, actually, because as far back as Herbert Hoover and the just before the Great Depression, we have these comparisons to an interventionist policy in terms of social policy as opposed to a laissez-faire or even an industrial kind of focused approach. So that is notwithstanding the interesting historical context of this, which many of you pointed out, and I thank you for that. I want to talk for a couple of minutes on three important points that have a couple of subpoints, but three important points that I want you to recognize in the context of cultural humility here. The first is stigma or policy, because both of those inform social behavior. Whether you're going to address stigma or you're going to be involved in policy practice, you're addressing social behavior. You're wanting to change someone's opinion and then therefore their behavior on something. Of course, stigma is more of that nuanced kind of change their perspective, whereas policy is, some people see it as being able to force people or reinforce, if you want to make it a little softer, their social behavior. But I think there's an interesting interplay there in stigma versus policy. It's the problem and the solution. When you're looking at stigma and policy, you're looking at its core, pulling back the veil. It's the perspectives that people have on what they're making their choice to do and how those decisions are made. And that's why many of you focused on recognizing that information was required. The case study, as all case studies do, would benefit from additional information if you were able to be in the assessment yourself and ask more questions. And that's where I get into this discussion about profiling. If you know me, you know my area is operational research, complex adaptive systems. I'm always looking at how the system impacts the behavior of the individual, because that's the best way to recognize how to create social change. So having that information, I call it a profile of the individual. All of these different factors, and you can look into my other work and see that we can map those multiple factors in any institution and really build the institution to support the best outcomes for the individual. Of course, that is a focus of systems change. And systems change, I think, looking at whether there were step down programs, whether if you didn't qualify for this program, you can qualify for another program, classes, mentorship, step up, wraparound services. There are lots of different things we can do in society to make it feel more nurturing and empowering toward every individual human being. And then the last thing is I really appreciate it when many of you recognized that you could see because you now understand social Darwinism, or you expanded your mindset to see the historical underpinnings of the attitudes of the medical staff. You could see that they had a reasoned approach to the outcomes and the conclusions that they were making. It wasn't just because they're bad people. They're really thinking this through, and they're saying, okay, if there's a person who comes in who meets our criteria and is deserving in the sense that they're qualified, then we should give it to them. We shouldn't give it to this person who's unqualified just because they're another human being. Which would you rather choose? That reasoning, it's called there's a logical fallacy in how they're structuring that argument. They're structuring it as you choosing one person over the other and making it a question of being deserving. That is appropriate in the sense that it's reasonable to approach it that way. But we can build our institutions so that we don't create those situations where we're choosing one human over another. We can say both and that's the type of policy we want to create. That's the type of institutions we want to support and create. This discussion of deserving and qualified is the second piece that I want to bring up briefly. Every human is deserving, but not every human is qualified. But we make that decision about who's qualified and who's not. We are the ones who create that policy. So again, I've already said this, the programs, the models, the policies, the theoretical frameworks we bring to bear, those are all our choices that we use within constructing the system. And so it is our responsibility. It is up to us. It is our fault if the systems don't work because we construct those systems. And lastly, my third area is depressing situations, kind of titled in that area. I encourage you, rather than being depressed and disillusioned and feeling bad and anger toward these medical staff individuals, you really want to be inspired and find joy in the work of recognizing their point of view and their perspective, and then walking through in your own work, not fighting against them or even advocating for or working with them. No, let's start with managing yourself, your nervous system in the context of engaging with policy practice, institutional change, and what I call in my work with Poser and with the mandate of social work, expanding into environmental practice. That's what we're talking about with social work next, so that you're able to see how to change the entire system, the the actual environment where these decisions are made, provide the individual information in the context of the collective, in the context of the institution, to create the society that we'd like to see, a just, pro-social, progressive society. That's what social work is all about, inculcated in the code of ethics. So let's get to that. Justice, dignity, and worth of the person, the importance of human relationships, service, integrity, competence. Talk to you soon.